The coronavirus pandemic hits Michigan with staggering numbers of over 20,000 cases and over 2,000 deaths. We spoke to a nurse who worked closely with patients that has been exposed to the virus. I've been a nurse for a little over 5 months now, and I attended Dorsey Institution. Number one symptom is a fever. Then it's tiredness, and then it's a dry cough. And then some people may experience aches, pains, nasal congestion, a runny nose, sore throat, and some people even get diarrhea. And I also want to say some people don't have, any symptoms at all. One of them is short staffing. We work short because nurses or staffing have to go in quarantine themselves, or it's the fear of the COVID-19, the fear of them catching it, the virus themselves, and they feel like they're going to bring it home to their family. And then another one is that, facilities are telling nurses to reuse their PPE, which is our protection gear. We're told that it's a nationwide shortage. So we're told to reuse this, because there's not enough supplies. I've only heard of 2 types of testing. One of them is the swab of the mouth that you see the news and the media talk about. And another one, second method that I actually done personally on a suspected COVID patient was we actually swab, the nostrils to get a sample of the mucus inside the nostrils. I have seen facilities have said a week. I've seen facilities get their results back within 24 hours. They're told to quarantine, yes, because they have the symptoms. Usually, what the World Health Organization, recommend is people who have been in close proximity or, with a COVID patient who's been diagnosed, who are tested positive. They've been within, close range, or if you're having the symptoms that I named earlier, they recommend that you go get tested. If you're not having any symptoms, they really honestly don't want you to come get tested because, they're saying that the test could produce a false positive or a false negative. So, they really want to keep those testing for the people who need it. When they're diagnosed with the COVID, you have to monitor it. It's what we call in the nursing field ABC, which is airway, breathing, and circulation. Breathing is your top priority. So we call it a respiratory surveillance, and that is where we take, the vital signs. We take the temperature, blood pressure, pulse, oxygen, and then we listen to their lungs. With the stethoscope, we listen to their lungs, and see how their breathing pattern is to determine if they're struggling to breathe. You struggling to breathe, breathing okay. That's one of the main things we do. Some of them might just need, oxygen. If it gets very, very serious, others might need to be put on a ventilator. Well, I do want to just say, for my other nurses and other healthcare workers that's out there, I feel where they are coming from. It's a lot. It's scary. A lot of people say that we signed up for this, but, on a daily basis, or we nurses and healthcare workers are used to dealing with patients who that has infectious diseases that require isolation. We're used to dealing with maybe 1 to 4 at a time, a small number to where we can contain the disease where it doesn't spread. We're able to contain it. We isolate, put our full gear on, but we're able to, it's not a big deal because it's only, a few people, and we're able to contain it within. But when you're dealing with the whole world who potentially has an infection disease, and it's everywhere you look, it's outside the health facility, and it's just everywhere you go, that's tough. That's hard. It's scary. We're not used to that. That's scary for us, But me personally, I have my faith, and I've always practiced good hygiene, as a healthcare worker.
Anybody in healthcare knows, like, good hygiene, hand washing, gloves, disposing in gloves. So that's going to protect you. So that's really what a lot of us are strapped tough in, and we can carry out and do our jobs. We can carry out and do our jobs.
To all of the healthcare workers out there fighting to save lives across the world, you are the real heroes. I'm Tia Nicole, reporting live from Detroit, Michigan, 88 First News.